From the very latest on Omicron to expanded eligibility for booster shots, at-home testing, let's talk COVID-19 with Dr. Ruth Berggren, infectious disease specialist at the Long School of Medicine at UT Health San Antonio. Good to see you, doctor. Last time you were here, we know that there was a lot of uncertainty about Omicron. There's been lots of reports saying perhaps more transmissible. What do we know at this stage?
Yeah, we continually get the same consistent reports of increased infectiousness, several times more infectious than Delta. And generally speaking, we continue to hear that when people get Omicron, especially if they're vaccinated, that it seems to be a milder version of disease. It does not seem to be more severe. It does seem to be more infectious. And an interesting tidbit that was on the news wires today in the medical newspapers is that people are theorizing that the Omicron variant has picked up a snippet of material from the common cold. And perhaps that's what's helping it have its advantage in being more infectious, just like common colds are so infectious.
And when we say more infectious, are we comparing it to Delta, the Delta version of COVID-19?
Right. Just more people per person infected, more other people, secondary cases are happening.
How confident are you in the early findings right now that it is less severe? I mean, is there still some question out there about that?
Well, I think we need more time to really study it. The reason people are hesitating is that the most reports are coming from where it was first discovered, right, which is South Africa. That's a demographically very different population than we have here in the United States, and it's a very under-vaccinated population. So drawing a lot of conclusions about what Omicron would look like in terms of severity here is not a wise thing to do. We need to see what it actually does do when you get into the United States or countries that are like the United States demographically, as well as with the number of people, percent of people vaccinated.
Speaking of vaccines, the FDA green lighting today booster shots for people as young as 16 for the Pfizer booster. Your reaction to that?
I think that's really welcome news. We know that boosters raise antibody levels. We know that with time, antibody levels begin to decline and we start to see breakthroughs. So getting this done, this authorization in advance of the Omicron variant really hitting the United States is a whole lot of common sense, and it will prevent cases and it will prevent serious illnesses. I want to remind everybody that people are still dying of COVID-19 in this country. We are seeing many cases in children for 17 weeks in a row. We've had more than 100,000 cases per week in kids. So when you talk about lowering the boosting age from 18 to 16, it's a good step, but we really want to focus on getting everybody fully vaccinated, down to the 5-year-olds.
I want to talk about the home COVID tests. There have been a lot of advertising, a lot of people advertising them as good tools to use before you go somewhere for the holiday. What should you look for when you go to the pharmacy or the grocery store when it comes to some of these home COVID tests?
Right. Well, I think it's always wise to make sure that whatever you're picking up, whatever it may say on the label, why don't you verify online that that is one of the emergency use authorized home tests. And there are at least 3 or 4 of them right now. Nobody's done any super careful head-to-head studies about which one is better than the other. And frankly, there hasn't necessarily been a whole lot of choice when you go to the store. So getting a recognizable brand that is well known to be EUA authorized, such as the Binax Now made by Abbott, just to name one example. Just make sure that what you're buying is on the list of emergency use authorized tests. Realize that you can have false positives and false negatives, but it's much more likely to have a false negative than a false positive. That means that if you get a positive test, you should believe it and you should quarantine yourself. And you may also get a PCR test, a molecular test, as a follow-up to confirm it. But you should behave from the moment you see a positive home test as if you really have COVID.
So if it is a higher chance of you getting a false negative, if you've got symptoms, let's say, but you still get a negative test result, what do you do then?
If you have symptoms that are typical for COVID, especially if you've got loss of your sense of smell or taste, together with the body aches and all those symptoms that have been described so well, you should continue to quarantine even though you have a negative home test. And that would be a reason to go and seek a PCR test, which you can get at many locations throughout the city. And just a good measure of common sense to keep yourself away from others. Don't go to work. Don't go to the grocery store. Stay home until you're feeling better, and try to get confirmation from another test.
You know, our local rate has gone from low to mild as far as the risk level for COVID. Are you concerned about the holidays, that we're going to see a spike post-holidays because of people who haven't got the vaccine yet?
Absolutely. You're exactly right that any spike that we will see will be in the unvaccinated population. And so please go out and get vaccinated.
All right, Dr. Ruth Berggren, always appreciate your time. Thanks so much for being here.
Happy.
We'll be right back.